You've probably already heard the buzz. 2026 is bringing big changes to Medicare drug costs. Some people are calling it progress. Others are worried it might actually make their out-of-pocket costs worse. But here's the real question. How do you beat the new price hikes before they start affecting your wallet? Before we dive into that, I want to hear from you. Comment your name and state below. I'd love to see who's watching and benefiting from these videos. It helps me know where people are tuning in from and what kind of Medicare challenges they're facing in different parts of the country. Now let's talk about what's really happening. Because if you're on Medicare, or about to be, you've probably noticed something over the last few years. Prices on everything are rising: groceries, gas, electricity, and now even prescription drug costs are catching up. But here's the thing, not all of these price changes are bad news. Some are actually the result of new Medicare rules that are supposed to help lower drug costs long term. The problem is, in the short term, some people might end up paying more, especially those who aren't on the right plan. Let's start with what's changing in 2026. For the first time ever, Medicare is negotiating drug prices directly with pharmaceutical companies. On paper, that sounds like a win, right? Lower negotiated prices mean more affordable medication for everyone. But here's where it gets tricky: not every medication is included in this negotiation. In fact, the government started with a small list of high-cost drugs that cost Medicare billions every year. Drugs like Eliquis, Jardiance, and Xarelto, the kinds of prescriptions that millions of seniors rely on daily. If you're taking one of those, you might actually see lower costs by 2026. But if you're on other medications that aren't on that negotiation list, you could end up shouldering more of the price difference. And that's why choosing the right Medicare drug coverage, whether that's a Part D plan or a Medicare Advantage plan that includes prescription coverage, is going to be more important in 2026 than it's ever been before. I've talked with so many seniors over the past few months who are confused about why their copays keep going up even though the government keeps announcing cost-saving reforms. And here's the truth: it's not that Medicare is lying to you. It's that these reforms take time to roll out, and insurance companies often adjust their premiums, deductibles, or formularies to balance things out. Here's a simple example. Let's say in 2025 you were paying $47 a month for your Part D plan, with a $545 deductible. That's pretty average. But in 2026, your plan might lower the deductible, which sounds good, but increase the monthly premium to $61. Why? Because they're shifting how they manage their cost structure due to those new negotiated drug prices. In other words, you might save on one end, but pay a little more on the other. So what can you actually do about it? The first thing is, compare your plan early. Don't wait until the last few weeks of open enrollment. Start checking your medications against each plan's formulary, especially if you take name-brand drugs. A plan that was perfect for you in 2025 might quietly drop your medication or move it to a higher tier in 2026. And that can turn what used to be a $10 copay into a $45 copay overnight. The second thing is to look into plans with preferred pharmacy networks. This is something a lot of people overlook. Some Medicare Advantage or Part D plans partner with specific pharmacy chains where your costs are significantly lower. If you're filling prescriptions at a non-preferred pharmacy, you could be paying 2 to 3 times more for the exact same drug. And then there's the issue of insulin. If you're diabetic, you probably know that Medicare capped the cost of insulin at $35 a month. That's one of the best things Medicare has done in years, and thankfully, it's continuing in 2026. But here's the part many people don't realize: not every plan handles that cap the same way. Some plans include it as part of their standard benefit, others require you to hit your deductible first. Always double-check how your plan applies the insulin cap, because the difference could mean you're paying an extra $100 every few months unnecessarily. Let me share a quick story. I spoke to a viewer from Arizona named Carol. She's been on Medicare Advantage for 3 years, and she takes 5 prescriptions every month, 3 generics and 2 brand name. In 2025, she was spending about $84 a month total. But when she got her renewal notice for 2026, her plan premium went up slightly, and one of her brand name drugs moved to a higher tier. Her cost jumped to $142 a month. She was frustrated. She said, "I thought these new Medicare negotiations were supposed to lower costs, not raise them." But when she compared her plan to 2 others available in her county, she found another plan that covered all 5 of her meds at the same or lower copay and even included dental and vision benefits. She switched and ended up paying $93 total. Not quite what she had before, but still way better than $142. That's what I mean by being proactive, not just reacting to price hikes, but planning around them. Now let's talk about one of the biggest secrets in Medicare drug coverage, the donut hole. Officially called the coverage gap, it's that frustrating point where your out-of-pocket costs jump after you and your plan spend a certain amount on prescriptions. The good news is, Medicare has been shrinking this gap year after year, and in 2026, it's smaller than ever. But it's not gone. For people with expensive medications, you can still hit that gap and feel it in your wallet. So what's the smart move here? 2 things. First, if your doctor prescribes a brand name drug, always ask whether there's a generic or biosimilar alternative covered at a lower tier. The 2026 formularies are adding more biosimilars. These are cheaper versions of name brand medications that work the same way, and switching can save you hundreds a year. Second, look at whether your plan includes mail-order pharmacy options. Many do, and the 3-month refill option can bring your per-pill cost down significantly. Something else you need to know for 2026, some plans are increasing their out-of-pocket maximums for drug coverage. That means if you hit a certain threshold, your plan will cover more, but you might hit that threshold faster if you take multiple brand-name drugs. It's a balancing act, and that's why reviewing your explanation of benefits, every few months is key. It's like checking your receipt to make sure you're not being overcharged for something you didn't realize changed. And it's not just drug prices, many Medicare Advantage plans are bundling more benefits in 2026 to offset higher prescription costs. We're seeing more plans that include dental, vision, hearing, and even fitness memberships at no extra charge. The strategy is clear. Even if premiums rise slightly, they're trying to keep members happy by offering broader overall value. So don't look only at the drug costs, look at the total picture of what you're getting. Another interesting trend for 2026 is how some plans are rewarding healthy habits. For example, there are plans offering gift cards or premium credits for completing wellness visits, getting flu shots, or maintaining medication adherence. Those might sound small, but over a year, they can add up, and every dollar you save matters when drug prices are climbing. Let's zoom out for a second. Why are these hikes even happening if Medicare is supposed to be lowering prices? The answer is, the system is shifting. Drug companies are adjusting to the new negotiation power Medicare has, and insurers are recalibrating their pricing models. It's like a tug-of-war between government savings and private company profits. In time, it should balance out, but for now, some of the cost pressure gets passed down to us, the beneficiaries. That's why 2026 is a year to pay extra attention, not just renew blindly. And here's a little-known tip: if you qualify for extra help, also called the low-income subsidy, your drug costs might not be affected much by these hikes at all. In fact, the program has been expanded, and more people will qualify in 2026 due to higher income limits. So if you haven't checked your eligibility in a while, it's worth doing. Even a few dollars difference in income could make you eligible for thousands in drug cost savings each year. Now, what if you're on Original Medicare with a standalone Part D plan? Don't assume that's automatically worse or better than a Medicare Advantage plan. It depends on how often you see doctors and what drugs you take. If you have multiple chronic conditions and see specialists frequently, Original Medicare plus a good Part D plan might give you more flexibility. But if your medications are stable and you like having your coverage bundled, with dental, vision, and prescriptions together, then a Medicare Advantage plan can simplify things while keeping costs predictable. Whatever you do, avoid staying on the same plan year after year without reviewing it. That's one of the biggest mistakes people make. Just because your plan worked great in 2025 doesn't mean it's the best in 2026. Formularies change, pharmacy networks shift, and costs fluctuate. A 15-minute review could save you hundreds, or even thousands, over the next 12 months. Let me give you one more quick real-world story. Joe from Florida takes 3 heart medications and 1 arthritis drug. His old plan covered all 4 for about $72 a month. Then, one of his meds, a brand-name arthritis treatment, got bumped to a higher tier. He started paying $48 just for that one medication. He was ready to just deal with it until his daughter helped him compare other 2026 plans online. He found one that covered the same drug as a preferred medication, with a $15 copay. That's the difference awareness makes: same coverage, drastically different costs. So if there's one thing I want you to take away from this, it's that you can beat these new drug price hikes. But it takes attention, comparison, and a little bit of homework. Medicare gives you the tools, you just have to use them. Here's what I'd suggest before the next enrollment period. Make a list of your current prescriptions, including dosage and brand names. Use the Medicare Plan Finder tool online or call a trusted local agent to run comparisons. Check not just premiums, but drug tiers, pharmacy preferences, and total annual cost estimates. And remember, don't get distracted by extra perks that don't apply to you. Focus on what you actually use and need. By doing that, you're not just reacting to price hikes, you're taking control of them. And that's the whole point of understanding Medicare. It's not just about finding a plan, it's about finding peace of mind in knowing that no matter what changes, you're covered the right way. If this video helped you understand what's happening with Medicare drug costs in 2026, make sure to like this video, subscribe to the channel, and share it with a friend who might be struggling with their prescription coverage. Every year, thousands of people overpay simply because they didn't know what to look for. Don't let that be you. And remember, these videos are here to help you make smarter decisions and save more of your money. Medicare changes can feel overwhelming, but when you understand what's coming, you can plan ahead and protect yourself. Thanks for watching, and as always, stay informed, stay covered, and take care of yourself.